Hey everybody, I'm Jay Scherr with Jay Scherr Business Consulting. We help entrepreneurs, business owners, and other leaders maximize their potential, build rock-solid foundations for their businesses, and create more freedom in their lives. And you've joined Business Minds Coffee Chat. Thich Nhat Hanh said, "The body and mind are one. When we calm our body, we calm our mind. When we take care of our mind, we take care of our body." Well, on today's episode, we're going to explore the topic of non-invasive therapies for addiction and PTSD, the role of psychedelics in mental health, bridging the gap between Eastern and Western medicine, a wearable technology that can boost energy and focus, reduce stress, and promote sleep, and more. My guest is a board-certified psychiatrist, neuroscientist, psychedelic clinical researcher, teacher, and executive director of the Board of Medicine. He received his MD in medicine and PhD in neuroscience from Albany Medical College and specialized in psychiatry with a distinction in research at Western Psychiatric Institute and Clinic at the University of Pittsburgh Medical Center. He's one of only a handful of psychedelic experts credentialed as an MD and PhD in practicing ketamine and MDMA-assisted therapy with his patients. Please welcome the CMO and co-founder of Apollo Neuro and the man who's helping us enhance the safety pathways in our nervous system so we can feel better and more at ease, Dr. Dave Rabin. Dave, it is so great to see you. Thank you so much for being here today.
Of course. Thanks so much for having me, Jay. It's a pleasure. And I just want to add one thing before we start, is that I only practice ketamine-assisted therapy because MDMA-assisted therapy is still currently DEA Schedule I federally illegal. So I am trained in MDMA therapy, and I do research on how MDMA therapy works in the body and the brain, but we can't, unfortunately, thanks to the FDA's August 9th ruling, we can't legally practice it yet.
Thank you for that clarification. I appreciate it. And that is something that I definitely want to touch on with you. But before we get there, I would love it if you would share with all of us what your favorite thing is about yourself and why.
Oh, that's funny. I don't get that question very often. But I would say my favorite thing about myself is my curiosity. I have always been a very curious person. I've always wanted to know why we do things the way we do them, why we make certain decisions the way we make them, why things work the way they work in the human world and the natural world. And that curiosity for me is like rather unbounded. Like, I don't really care about what's been done before. I don't really care about, the fact that we've done things forever and that's just the way we do it. That's never satisfied me. And I've always just tried to figure out like what's actually going on, right? What is humanity really here to do? What are we as individuals here to do? What does the biology say about that from a very like objective, science perspective, and really just like throwing my detective hat on and trying to figure out, the big why.
I love that. That's what a fantastic trait. Now, have you been
curious? To my parents' great dismay, of course.
Yeah. Okay, so both your parents are physicians, and how did your upbringing influence your perspectives and how you view the world today, and tie in that piece of curiosity as you answer that question, if you will?
Yeah, of course. That's a great question. I think there's a couple ways that my upbringing influenced my life state, my life goals, development. How I came to sit here with you as a neuroscientist and a psychiatrist. I think the main two reasons were from a very young age, growing up Jewish and growing up in what I would call, for many Jewish folks who were growing up during my time, all of our parents experienced the Holocaust firsthand or secondhand. or had family members who were involved somehow in it and escaped or didn't. And so that really shifted their perspective on trusting other people, trusting the government, trusting anyone, building close relationships. And, I think that, and I think it's interesting, not to spend any more time on organized religion, because I think it has a lot of problems, but the Jewish culture is very interesting in that we're always encouraged to ask why in Jewish culture. And if you look at the history of Judaism, what's real, like many of the rabbis spend their entire lives reading religious texts and then interpreting them and arguing with each other about what they say, right? Like this is like a core part of Jewish culture. And when I was learning, I was bar mitzvahed and went through, my Jewish American upbringing, that was still part of it. And it permeates. And even when we go to synagogue, on the weekends, like there were occasionally when you go, there'd be times where the rabbi would give a sermon and he'd ask the audience, the crowd, what do you think about what I just said? Right. And I, when I brought my now wife to some of these high holiday sermons and that kind of thing for these events at synagogue, she's Catholic. She couldn't believe that the religious leader, the rabbi, would ever ask the audience what they thought. Right. It was just never something that she had ever seen in Catholic religion or Christianity. It was just not common or not normal to ask those kinds of questions. So there's certainly a cultural relevance to the big question of why, and kind of turning over every unturned stone. And then the second piece of it is that my parents are both physicians, and they've both done research. And as a researcher, you have a different approach to clinical medicine than as a doctor who's just providing care. As a researcher, generally speaking, and a doctor, you're always looking for a better way to do things. You're always looking outside the box at a problem and not just saying, oh, this person's sitting in front of me and they check these boxes but not these boxes, so I'm just going to give them the things that address these boxes and target the symptoms. You say, well, could there be something else going on beneath the surface I'm missing, right? And then that unlocks this diagnostic framework of thinking that we all learn in medical school, which is like, how do you understand a problem in its entirety and try to figure out what one or two things could be going on that are at the root cause of that problem, not just let me give you something to make your symptoms go away and let's put a Band-Aid on the broken leg or whatever it is. It's like, let's figure out what is at the root cause and try to get to that root cause like a detective, like who is the culprit here, right, in the body or in the mind, and let's try to help you figure that out. And I think that mentality of my parents, especially my dad is also an electrical engineer, so he is very into figuring out how things work. He taught me how to fix a lot of stuff in our house growing up. And so a lot of it was like always learning about why things work, how they work. And that just fascinated me. And then my favorite part of this story is when I was about 7 years old. I remember from about 4 to 7, I started having my first memories back when I was about 2. But when I was 4 to 7, I started to have, I can remember much more from that time because I started to have very vivid dreams. So just dreams that were so real that I could not distinguish them from my regular waking life. So they weren't necessarily scary or flying dreams. Sometimes they were, but usually they were just like, it would be like me having a conversation with my brother or a friend. And then I would be talking to that person the next day or the day after, and I would mention the conversation we'd had or something that happened. They'd be like, what are you talking about? That never happened. And I'd start to ask myself, wait, did that happen? And they just don't remember, or was that a dream? And this started to happen not very often, but it happened, repeatedly. And then when I became about 7 or 8, and I was really going to school more as a regular, young person, I, started to have more nightmares. And I went to my parents and I said, what are these dreams? Because they're starting to get scary and it's, making it hard to sleep. And my parents, like many parents, said, don't worry about dreams. They're not real. They can't hurt you. And what they really meant was like, they can't hurt you, right? That's the most core take home there for any kid. Don't be afraid of sleep. Dreams are there. They just happen, but they can't hurt you. But that was never full enough explanation for me. And I really clung to this concept of the word real, because for me, after they said that, of course, I keep having these dreams. And then, as an adult talking to other people, especially my patients about their dreams, I realize I'm not the only one who has vivid dreams. This is like common through all humanity, that people have vivid dreams sometimes that it feels so real that they don't realize they're not. And then as I kept having these dreams and they kept feeling real, the feeling overtook my understanding of that word that my parents were trying to convey to me, which was, this is not real. But if it feels real as regular waking life, then there has to be some realness to it, right? Maybe the adults don't have the definition of the word real correct. And so it was really around that age of like 7 or 8, I started to ask this question of like, what is real? What does that word even mean? And is there like some other subjective, understanding of these terms that we use to describe reality and experience that are not fully there, right? Like we're missing a bunch of what's going on. And that really what spurred my curiosity in a large way, like a big way, going into like science fiction and consciousness and neuroscience. And I started to just read, especially as I got into high school, I just started to read everything I could find on consciousness and meaning and realness and all of these things. And sci-fi was like a big outlet for me at that time. But ultimately, you can see you could draw some lines as to how that led to where I am today.
Absolutely. Well, first of all, this is fascinating. And you just shared, there was a lot in that. And there's a couple things that I wanted to maybe explore based on what you just shared. So pull on a couple of threads. One of them is, when you mentioned about your Jewish upbringing and about the rabbi during a sermon asking the congregation what they thought. As you were having these dreams, you're 4 to 7 and then 7 to 8, at any point, did you happen to sit down and converse with your rabbi about these dreams, knowing that he was asking some interesting questions that would lead to maybe unpacking something a bit more deeply? Did you have those conversations? And if so, what did you discover? And if you weren't talking with him, other than your parents, was there any other adult figure who entered your life at this point to help you explore this more deeply?
No to all those questions.
No. Okay.
At the time, I don't think I had all the words to describe what I was experiencing.
Sure.
And so, I wasn't brought up particularly religious. So I didn't go to synagogue or interact with any religious figures very much at that time. The experiences I had where I remember the rabbis asking the congregation about their thoughts on a sermon or a religious text or something like that, or interpretation, came much later, like during my 12 to 14, like bar mitzvah years. But the point of that was that the idea of even asking those questions being okay is something that was a part of our culture. And I never talked to anybody about this stuff because I always thought that it was weird. I didn't know that other people were having these experiences. So I was like, I don't know if I feel like I didn't have the words and I didn't really feel comfortable exploring it with anybody. So I never talked to anybody about it in detail. And it wasn't until much, much later when I was in probably like medical school, really graduate school, when I really started seeing patients and talking to them about their experiences. Because when you talk to patients, and you build a trusting relationship with a patient, the amount of healing they get is directly proportionate to how candid they are with us, how much they're willing to say and tell us about their experience. So people are willing to tell you their deepest, darkest secrets if they trust you as a doctor or a therapist. So I started to get more perspective from my patients on what they were experiencing. And then I started to realize, oh, wait, this is like universal human experience. This is not just me. And then from there, this is going back to like early 2000s. And then from there, I started to really dive into this and learn more about these are really common human experiences. We need to talk about them. And that when you start talking about them with your patients, you can actually start to help them sift through what is going on underneath the surface in your dreams, which in a lot of ways is like the very first psychedelic experience that any of us have after being born is dreams. And it requires no drugs, which is really interesting, right? Because psychedelic means to reveal the mind. So it's looking beneath your consciousness at your subconscious and unconscious material. Dreams are like that in a lot of ways. It's like accessing the same state. You're in REM sleep, your memory like the neuroscience really helped me. So when you enter REM sleep, which is when we do most of our dreaming, you're reconsolidating memories, which means you're taking the short-term stuff you just learned, and then your brain is processing that in the hippocampus and then passing it through all the way up to the long-term memory centers and organizing it. It's not just sending stuff into long-term memory. It's saying, this is worth keeping, and this is where it belongs. This is where it kind of sits in your framework of the world. And if you don't get good, deeper REM sleep, not only do you not get the recovery that you need to function during the day, and you feel tired a lot, but you also lose memory reconsolidation. And your memories can get disorganized or incorrectly placed in long term. So they're not like forming a concept of the world that's consistent with quote unquote reality, right?
So let's just talk about those memories for a moment. When those memories are cataloged and stored, as time goes on and as we think back over storylines in our life and those memories, does the way that we remember things happening, does that change and evolve over time? So even though the memory may be stored, our version of it or the way that we recall it, does that change with the passing of time?
So absolutely. Meaning changes over time. So meaning is a neurological process. Meaning is a process by which our neurons are talking to each other differently. And the reason why we form meaning, which is like the emotional content of an experience, is based on how we experienced it in the first experience, right? So trauma is a great example of this, because when people experience trauma, which you can define trauma kind of in the modern definition as like one or multiple intense, meaningful events that happen over time where we feel unsafe and not supported, right? When those things happen, you are experiencing hardship from the perspective of not being safe. And so what happens? Well, you start to feel more unsafe in your own body anytime you're exposed to anything that reminds you of that challenging experience. To somebody else who has the exact same experience of hardship in a safe environment, they don't call it trauma. They call it growth, right? They call it learning. They call it developing new skills, right? If you take somebody who's experienced trauma and then you work with them in a therapeutic way, like we do in our clinic, and you help them reprocess the trauma from the perspective of safety because they trust me, and trauma essentially is the core trauma that happens and the response in the body after a traumatic event is what Gabor Mate talks about this a lot. It's this idea of like fractured self-trust. So that's the core trauma. It's if I couldn't keep myself safe in this situation and then I tell somebody about it and they blame me for getting myself into trouble, right? Rather than supporting me, then I feel like there's something wrong with me. And then I can't keep myself safe. Why wouldn't this happen again? Right? Can I trust myself to keep myself safe if something like this looks like it's about to happen again? Right? And so what that does is it takes your sense of self, which might have felt safe before you had that experience, and distorts it to one in which you no longer feel safe within your own skin. Wow. Right? And so now thinking about yourself takes on a meaning of uncertainty, fear, unpredictability, right? And that has a physiological response where your heart rate goes up more often and your blood pressure goes up more often and you breathe fast more of the time and you respond to stress hyper reactively, too fast, too much, when there's no stress actually around. So when we do our trauma therapy, healing and processing with people, with or without psychedelic medicine as a tool, what we're actually doing is we're helping somebody re-experience in their own minds and bodies the feeling of going back and putting themselves in that position where they were traumatized or right afterwards, and they had that hardship, and then reprocessing it from the perspective of safety. And all of a sudden they realize, oh, that's not my fault. I was just doing the best I could. I couldn't have known better. And then I didn't have the support systems around me to help me after. But this event no longer defines my sense of self as a victim. It doesn't define me at all. It's just an experience that I can learn from. And then all of a sudden you have literally shifted the entire meaning of the past that might have defined you for decades into one that you can move forward from and leave behind, but move forward from in a way where you're growing from it and becoming a better, stronger, faster version of yourself, rather than somebody who constantly feels like everything's out of your control and this experience you had is holding you back forever. Does that make sense?
It makes a lot of sense. So can you maybe give us a tangible explanation? I know this may be challenging, but when you're working on this reprocessing, it to me is that reframing the storyline, reframing the emotions, the feelings, the physiology, all of that to rewire or regroove the memory or the story from a perspective of safety, support, and empowering emotions. I'm trying to. I understand in essence where you're going. I want to be able to give our audience maybe a bit more of an explanation of what's happening, what you're actually doing.
Yeah, so I'll give you a very tangible example. So imagine that when you're a kid, all of your friends go to get ice cream and with you, and it's super fun, right? And you have these very fond, very pleasing memories around getting ice cream with your friends and your parents. And then one day you're like 8, 9 years old, and you walk into your ice cream shop and you get your ice cream, and somebody comes up to you and says, hey, I don't like you, and they beat the crap out of you, right? And then you go and tell your parents, and your parents are like, what's wrong with you? Why'd you let them get away with that? Right? Pretty normal, not good response, but a very common response, and very detrimental, because now this person who had this experience literally just went from associating ice cream with pure joy and love and deliciousness to being afraid to walk anywhere near an ice cream shop because it's a source of threat. They don't know if they're going to be safe if they walk in there, right? Because now that same person could be lurking inside and just beat them up for potentially no reason, right? And so what the treatment for that is, you've already seen one shift in meaning, right? You saw the shift in a memory of joy around ice cream to a memory of fear. And then everything around that, the kind of music that was playing in the ice cream shop at the time, the temperature of the air, the location in your town, the smell of waffle cones, all of these things can now trigger that same fear response. So you've seen one complete meaning shift. Total polar opposite from safety and joy, childhood joy, to fear, right? And so that has shifted meaning. And then to treat that, what we would do, this is a very simple example, but what we would do is we would take that person and we would expose them to the memory. We just say, hey, walk us through the memory of what happened. And they would walk us through, and we just say, all right, what are you feeling in your body? What are you feeling? What are you thinking? What are the thoughts that come to you? And we talk through it, and we help them like verbalize it and get it out. And then we say, well, do you know you're safe right now, even though you're having a hard time, remembering this? And like, yeah, I know I'm safe. I know I'm with you. I know no harm can come to me in your office or, wherever I am right now, but it's still painful. And so we say, okay, great. That's a great first step. You know you're safe. You can remind yourself you're safe. Step number 1. Number 2, then you start to say, all right, well, let's take you to this. Let's bring the smell of waffle cones to you, right? Let's bring the smell of ice cream. Let's walk around the area of your neighborhood where this happened. And we do that. And then that person starts to get afraid. And we say, you know you're safe right now. And they say, yeah, I know I'm safe, but I'm still having like these fear memories come up. And we say, okay, well, tell us what that feels like. Like, what are you noticing in your body? Where is that fear stored? Is it in your chest? Is it tightness? Is it your shoulders going up? Is it your muscles getting tight? Is your neck sore? Are you getting tunnel vision? Like, what is it? What are you experiencing? And that's called somatic processing. So it's really like bringing somebody back into their bodies, because the body is always in the present. The mind can be anywhere. It can be in the past, present, or future. Usually in the past or the future, especially if we're untrained, like most of us. But the body's always in the present. It's always in the here and now. It doesn't go anywhere. So the somatic processing directs people back into their bodies, back into the present, and then they can acknowledge, hey, my body's feeling really upset right now, and this is a fear response, but it's not warranted because Dr. Dave or my therapist here, and I know I'm safe, right? Then third step is you take them into the same ice cream shop or into a different ice cream shop, right? Okay. Then you take them into the same ice cream shop. You repeat, same thing over and over and over again. And after you've done that, which is called cognitive behavioral therapy with exposure, or prolonged exposure, which is the leading talk therapy technique for PTSD, then every time you expose that person to the feeling of being safe in a situation, any of those situations I just mentioned that used to trigger a direct fear response in their bodies and minds to the point where they, might faint or collapse or have to go to bed or have to run away or whatever it is, right? Or get into a fight with somebody, get on guard. You've literally retrained their brain with them. They've retrained their brain with your help to now associate that experience again with safety, just like they did when they were a little kid. Does that make sense?
It makes perfect sense. That is truly fascinating. So is there, if somebody came to you with something that they were trying to, some trauma that they're trying to work through, and
like ice cream trauma,
like ice cream trauma, right? And is this type of therapy that you're describing right now? So we haven't introduced psychedelics at all, right? But this type of therapy, is it something that can be that can truly help someone after one session, 2 sessions, 10 sessions? Does it depend on the individual? Does it depend on the therapist or the psychiatrist? Give us an idea of how long it takes to resolve trauma of this nature.
Yeah, so it's a good question. It's different for everybody. So
okay.
Typically with kids who have had severe childhood trauma, it takes longer, especially if those events repeated over and over and over again, right? So if a parent beat you, treated you badly, whatever it is, somebody who's like an authority figure who you're told is supposed to love you and show unconditional love and affection, right? Those kinds of traumatic events can be sexual trauma, for instance. Those can take much, much longer for people to recover from. I would say on average with cognitive behavioral, it's called CBTE, which is again the leading psychotherapy technique without drugs for treating PTSD. We usually see, if people do the techniques and practice regularly without any other assistance other than your good well-trained therapist or psychiatrist, it usually takes somewhere between 20 and 40 weeks to decondition the response. So it's like memory conditioning is what we call when you're learning something, and then this is the deconditioning of that memory. So you're dissociating the fear response from your sense of self and from the location and the smells and the tastes and all that stuff, right? All the triggers. So that's the deconditioning. That can take 20 to 40 weeks. It could take even longer for a lot of people because the practice of CBTE, this therapy technique, is very, very time consuming, and it's challenging because you're re-exposing yourself to things that make you uncomfortable. So like people naturally recoil from it. It doesn't sound fun. It's not fun. It's just really works when you do it right. The reason why psychedelic medicine and technology like Apollo, which works in a similar mechanism through activating the safety pathway through the skin, and hand-holding and soothing touch and soothing music and all of these things work well, is because they accelerate the process of helping you feel safe in your body. So if you do more things or have more tools around you that remind you you're safe when you used to feel afraid, and then you recognize, hey, I'm not actually under threat right now. I'm not going to get beaten up. I'm not going to get made fun of. Nobody's going to attack me in any emotional, mental, spiritual, physical way. I'm okay. I'm safe. But I used to feel afraid in this situation. You've already closed a circuit loop, right? You've closed a deconditioning circuit loop. You've shown yourself, I can feel safe in this situation that I did not feel safe in for many, many years. So every time you close that loop, you're retraining the brain. And that's what neuroplasticity is it's basically like shifting the learning experience to form new neural networks around what's real, and in terms of what's real to us, in terms of, is this actually safe, or is this actually a real source of threat, like a real survival threat? And when you help people relearn that, then they can go for their lives. If they learn it well, relearn it well, and do the therapy well, they can go their whole lives without having these issues come back again. However, again, it's incredibly time intensive and it can be very expensive. And so where psychedelic medicines and tools like Apollo come in is they amplify that safety piece of the pathway. So if you imagine, like, we have a network in our brains that's responsible for us feeling safe emotionally, mentally, physically, and not under threat. And that activates an entire set of nervous system pathways that are governed by the vagus nerve, which is one of the most important nerves in the body for calming the body down and triggering recovery responses in the body, which includes digestion, immunity, reproduction, creativity, empathy, right? Metabolism, sleep, all of those things are regulated by this nerve to trigger the recovery response and the healing response. If you feel afraid, that nerve loses resources. It basically, your brain shuts that down because you don't want your recovery nervous system to be active when a bear is chasing you in the jungle or the forest, right? You need to be getting out of that situation. But the body gets tricked into thinking there's a bear in the ice cream shop, right? So then you introduce a psychedelic medicine, and even in just 1 to 3 doses with the psychotherapy, the same psychotherapy I was just telling you about, you accelerate that process from like 40 to 60 weeks or 20 to 40 weeks or more to 12 weeks.
Wow.
And with ketamine or MDMA, we do like 3 to 12 doses of medicine, and then this rapidly accelerates the neuroplastic learning potential of the safety pathway by basically throwing like fuel on the safety pathway. And you throw that special like nitrous fuel on the safety pathway, and then you feel like radically safe, like as safe as you might have felt, not as safe as you might not ever remember feeling. Like most people who feel these experiences, they call it like child's eyes, because it's the safety feeling you felt when you didn't even know there was threat in the world. Like you were that young. Wow. Right? It's like seeing the world through the eyes of an innocent child again.
This is truly incredible. So I wanna stay on this point here for a moment, because you had mentioned about MDMA at the beginning of our conversation, right? You helped to clarify something for me, which I appreciate. So you have said that MDMA therapy is one of the most important medical discoveries in mental health, akin to the discovery of antibiotics. That's huge. Now, as we had mentioned at the beginning of the episode, the FDA recently declined to approve MDMA-assisted therapy for PTSD, at this time asking for further research on the safety and efficacy of the treatment. Huge blow. So yeah. I would love to hear from you first. What are your thoughts on the decision that the FDA made? And realistically, what are the next steps? How long is it going to take to get it to a point where it goes back in front of the FDA? And why was the decision made? Do we know why the decision was made other than what we're being told?
Yeah, it was disappointing is an understatement of the century for this. But for this decision the FDA made, and suffice to say it was not evidence-based or scientifically based. It was based on risk aversion. The FDA is a governmental agency. If they approve a treatment that they perceive to have undue risk or just risk they don't understand, because it's the first of its kind psychedelic medicine to be approved as a psychedelic medicine for treatment, then they tend to make a decision that is from the perspective of risk aversion and just to minimize their liability, right? Okay. So that's for the most part, like, these are not bad people. That's just where this was coming from, and they don't understand how MDMA works. And if they understood how MDMA works, which we're trying to put out there into the world, that MDMA works by amplifying the safety pathways in the brain, that's how it works. And it amplifies safety learning to accelerate the therapeutic process of trauma healing by helping you literally feel safe enough to remake meaning around past trauma from the perspective of safety, right? If you think about that and you understand the neuroscience, there is no possible argument that this medicine, especially with all the toxicity trials that are well documented, that MDMA is safer than most other medicines we administer in mental health, with less side effects when it's administered properly according to protocol, which is the protocol that was submitted for review. There is no argument at all that's evidence-based that MDMA used properly is unsafe. There's no evidence for it at all. So they don't understand that. And none of these people, for the most part, who are responsible for making these decisions at the FDA level, have that background in psychedelic research or neuroscience or trauma or PTSD healing to understand. And most of them don't, if not all of them, don't see patients. They don't work with these people. So they don't understand that by saying we are not confident in the safety of this medicine used according to protocol, when they approve opiates that are killing tens of thousands of people a year, right? By accidental overdose. They approve benzodiazepines that are one of the most highly addictive mental health medications that have ever been invented. They improved SSRIs that have tons of side effects and are great for some people, but they have tons of side effects that are actually real, like not being able to have an orgasm anymore, or in kids under 24, they can increase risk of suicide, right? Like these are real risks. MDMA does not carry a single one of those risks even when it's used improperly. So to say that a safety-based treatment is not safe enough to get to the public when veterans and people with PTSD have like twice the suicide rate of the average American, and they're saying effectively that it's safer to live with untreated PTSD because over 70% of these people who are ever diagnosed with PTSD are never getting adequate treatment. They have this diagnosis for life. So they're saying it's safer to live.
Whoa, wait a minute. 70%? Over 70%?
Of people who are diagnosed with PTSD never reach full recovery, but with our current treatments available. It's an astounding figure.
That is astounding.
So this is why I was really fascinated by this topic. It's even worse for addiction cases. And when you combine it, people who have addiction and PTSD, these people really struggle for their whole lives. And we are really ill-equipped as a medical community to address this. So MDMA is the first and only tool that we've ever had that within 12 weeks gets over 55% of these people to remission, symptom remission, in just 12 weeks. It literally, with like an 80% response rate. It is unheard of. It's like that's why I say it's like antibiotics, because we've never had a drug that you take only for a short time in just a few doses and have that kind of effect on a mental illness. It's never existed before. Prior to the discovery of antibiotics, we didn't even know you could do that for infection. Infection was the leading cause of illness or mortality, morbidity, right? People would, if you got an infection, you could die or lose a limb, and that was standard practice, standard course before antibiotics. All of a sudden, Alexander Fleming synthesizes penicillin for the first time in like 1928, and within 20 years, without any rigorous clinical trials, we are curing people in under 12 weeks that were never curable before. They were considered to have lifelong illness. This is the stage we're at with PTSD, where we're taking people who, for the most part, have a lifelong illness once they get diagnosed, lifelong, very high morbidity, mortality rates compared to the average American. And the FDA in this ruling is basically saying, in short, I'll summarize it for you very, very succinctly, that it's safer to live with untreated PTSD than it is to receive MDMA-assisted therapy from trained providers. Nothing could be more absurd than that statement when you understand how this medicine works and you've seen and work with these patients. So who knows how long it's going to take to get this over the line? It's not, we don't know. Okay,
so based on everything that you just said, if you were putting the case study together with a team to reintroduce this to the FDA, what would you be doing differently this time than what we had just gone through?
You mean if I was compared to what MAPS did when they went to the FDA?
So what would you be doing differently?
I wouldn't be doing anything differently. I don't think MAPS did anything wrong. I mean, when I've been working, no, I've never been an employee of MAPS. I've never worked for them. I've just been following their work and collaborating with them to study how psychedelics work in their trials for many years, and been fascinated by their work. And, I think that when I have done a critical review of everything that they've done and all of the work that they've done, I think there are very, very few things I would do differently. I think, one of the only things I would do differently is I wouldn't allow couples to be trial therapists. So there was one circumstance in an earlier trial that got called out, and a huge amount. It was in all of the patients, there were 200 plus patients who went through these research subjects who went through this FDA trial, or the series of FDA trials. And there was one study site where there were abuses by a couple. And one of the members of that couple was an unlicensed provider. So number one, no unlicensed providers in the trial. Number two, no couples can deliver this treatment in the trial. It's fine. It might be fine in practice because the medical boards will, discipline anyone who violates protocol in the real world, but in a trial, it's different. And so, you have to be extra careful to not compromise the situation. So that ended up drawing a lot of undue attention because of this unlicensed provider who happened to be a member of this couple, and they had to pull all of the data from that study site out. Interestingly, the findings were still significant. Even when you take all of the patients who went through that study site out, the findings are still leaps and bounds better than what we're doing currently. They're still hitting the same qualifying numbers. But other than that, that was one case of abuse in all of those people. Think about how many surgeons every year abuse patients when they're under anesthesia, right? I had somebody in my medical school class who I didn't know. Just to give you an example, because people are calling MAPS out for all of this, I would say just on the surface, MAPS took, for all intents and purposes, they conducted their trials better and more thoughtfully than most big pharma companies with big pharma budgets. They did that all with donations. Wow. Almost all donations. Almost everything they did was spot on. Could you do things better? You could always do things better. Sure. Right? But what they did was spot on. So I think that across the board, and the fact that they got the results they got is just absolutely stunning. It's next level for the field. And to put it in perspective with how many abuse cases there are in mental health or medical world in general, I had one doctor who I didn't know very well, but he was a year below me in medical school, who graduated from my medical school as a doctor, became a gastroenterologist, worked in New York, I believe, and treated patients and abused 50 to 100 women while they were under anesthesia getting their colonoscopies.
Oh.
50
Lord.
to 100 women. And the only reason they caught him, because none of the women had any idea what was going on, because they were under anesthesia, which is the most vulnerable position you can be in as a patient when you're totally knocked out. You have no say over what's going to happen, unlike MDMA where you have lots of say. They would have never caught this guy, probably for years, had he not filmed it on his phone.
Oh.
Right? So you could just think about that and take that into perspective when we're thinking about what we're saying here about something like MDMA-assisted therapy, where the mechanism of its action is safety amplification, right? And there's two therapists, not one, so everybody's always being watched, right? There's a lot of safeguards in the MDMA process. And the abuses in the medical system are rare across the board, but they still happen, and they happen at a much higher rate than people realize in general, regular old Western medicine than in MDMA-assisted therapy. So these are really, if you don't have that historical context or know that this stuff is going on, you think that MDMA is a standout aberration and that needs to be ridiculed, but that's not the case. This is a systemic problem.
Well, first of all, I can feel your passion around this, right? I can feel your energy on this one. And it just takes me back for a moment about what you had talked about, curiosity, right? You're looking to uncover and figure out how things work, why things are done, why decisions are made, etc. And it seems like, and I know this is at a very simple level, but it seems like there's a a knowledge gap at the FDA, right? A knowledge and learning gap. So understanding everything that you just shared about all the reasons why it does work, but they wouldn't know, right? Because they're not practicing, they don't see it in action. It seems like there's got to be a way to be able to convey that knowledge in a way that lands and resonates, so it starts to change minds. Because otherwise, if you're presenting the exact same type of information, research studies over and over again, why would they make different decisions? So we're not going to solve it here. I just throw that out there because it seems like there is something that could be done differently than what has already happened.
Absolutely. You nailed it. And we're working with our nonprofit, the Board of Medicine. We're working diligently to bridge that knowledge gap with clinicians. We're not,
Excellent.
it's going to take decades to do this work, but we're working on it. And over time, we will close that gap. But we have a long way to go at this point.
Okay. So I would love it if we could just very briefly talk about the differences between Eastern and Western medicine. I know it's a big topic, but I would love to hear specifically from you around certain types of historical and cultural and civilizational research that you've done, and how medicine is treated, especially from a mental health perspective, how it's treated differently between East and West.
So I think the easiest way to explain this is that both are great, fantastic. Tribal medicine also fantastic in its own right. The major difference with Eastern and Western medicine, to answer your question, is that Eastern medicine is primarily preventative. So it's about understanding the state of the body when it's well and doing things to keep it well. And really focus on getting to the source of the problem. When you're talking about like different illnesses that Eastern medicine treats, they really try to figure out at the core, like, why is this happening? Why are you having this inflammation or pain or whatever from their perspective? And then how do we change something in the mind or the body or both to prevent you from getting worse, and then ideally to prevent this situation from happening again? And so Eastern medicine is actually interesting in particular to me because the Eastern medicine approaches to chronic illness and addressing the burden of chronic illness. So illnesses that are not just like you have an infection, you need to treat it right away, or you're hurt yourself, you cut yourself, you have an injury, you're about to die, you have a heart attack, right? Eastern medicine sucks at treating those things. Terrible. But that's why Western medicine is so great. Western medicine's strength is treating the stuff that can kill you right now. Nothing is better than Western medicine to treat you emergently right away if you're about to die or about to have a very serious problem as a result of not being treated. But Western medicine tries to apply those same techniques to chronic illness. And acute illness and chronic illness are very, very different. Chronic illness is due to things that are happening to you on a daily basis or momentary basis that are consistent across time. And that requires behavior change. It requires other kinds of interventions that are really looking at the bigger picture of you as a whole person, not just your pain in this one area that has no physical thing that we can see on a scan or an exam, right? It's not just looking at the one spot. It's looking at what's happening throughout your whole body and your mind. Could it be stress? Could it be not sleeping enough? Could it be, so many different things that it could be. Could it be diet related, right? Like Eastern medicine looks at all of that. And so Eastern medicine's real strength is treating chronic illness. And to a large extent, a lot of the Eastern and tribal techniques are very interesting when you look at mental illness, because mental illness is a chronic illness and really the epidemic chronic illness of our times. But Eastern medicine Western medicine can't hold a candle to Eastern medicine in terms of the way that they treat chronic illness. But Eastern medicine can't hold a candle to Western medicine in the way that we treat acute, immediate emergency illnesses. So the beauty of the modern era of medicine is, where do these two come together, right?
Yeah.
How do we take the best of what has been learned and practiced for thousands of years of Eastern medicine and tribal medicine and combine that with the best of Western medicine, so that we're not accidentally using the wrong approach or modality to treat what is right in front of us, right? Does that make sense?
It does. So do you think that that particular area and being able to create that hybrid approach, are we going to do you see a trend moving more in that direction? Are you seeing a growth in that area?
Yeah, I mean, it's happening in different places, right? There's absolutely a trend in that direction. You see that now because there's so many doctors out there who call themselves holistic doctors. So like, I'm a holistic psychiatrist. I don't just look at check off the boxes on a mental health survey and tell you have depression. I look at all of you and your past and your present and everything that's going on. And we start with a lot of Eastern interventions for mental health before we start prescribing medicine, because those often work faster and help the person build a sustainable improvement rather than just giving them a medication that numbs them to their feelings, which doesn't actually solve the problem, right? The Western approach is you give them the medicine to numb them to their feelings. Guess what? You stop that medicine, those feelings are still there. What are you going to do about it then, right? So it's really the combination of these two that we're seeing emerge into into medicine as a whole in the United States and hopefully around the world. But there's a lot of doctors who are practicing this way now and clinicians. And Apollo is actually an example of our hybrid approach of Eastern and Western philosophy and tribal philosophy to the community, where, we've known for thousands of years that sound can be healing. We've known that, right? We've known that music can induce altered states of consciousness. We've known that it changes the way your body is working. It changes your heart rate. It can change your breath rate. It changes your blood pressure. It changes how relaxed you say you feel, your muscles. We also know that soothing touch does that, right? We know that soothing touch releases all the best hormones in your body when it's consensual from somebody you like, right? Or when you touch somebody else consensually that you like and they like you, right? It's just a magical experience that is fundamentally biological, and we are all first exposed to it when we're first born and our moms pick us up and cuddle us and nurse us when we're crying, right? After taking our first breaths. This has existed, this like soothing touch as an example, has existed for 50,000, maybe 50 million years, since the earliest mammals first walked the earth and nursed their young, right? So it's hardwired into our bodies to receive this information, this healing information through touch. But it doesn't exist in Western medicine. In Western medicine, we are taught to not touch our patients except for a procedure, right? In mental health, you're not supposed to touch your patients at all. Like, you shake hands. That's the extent of your entire touching with your patients, right? So this is a problem. And it's a huge problem, because most of us are not getting enough hugs. Most of us are not holding enough pets. We're not getting enough cuddles, right? And not getting enough hand holding, especially in the Western world, especially in like the, Anglo-Saxon derived puritanical world that taboos sexuality and intimacy, right? Like, we don't get enough of this stuff. So what happens? Well, when we don't get enough of it, we seek the same chemicals from the outside. We seek the same chemicals, like opiates. We make our own with touch. So if you don't get touch, a lot of those people are more prone to get opiates outside. If cannabinoids, endorphins, dopamine, serotonin, oxytocin, all those things come naturally from being consensually touched by somebody you like, or holding a pet. So Apollo was developed based on our understanding of these pathways that are highly evolved at the University of Pittsburgh, by looking at the safety pathway that MDMA activates and saying, hey, if MDMA activates safety pathways and that's how it accelerates the speed of treatment, of trauma treatment, then perhaps we could give people something they can take out of the office that gives them the feeling of soothing touch, and then that is going to help them feel safe in and out every day of their lives. And every time they don't feel safe, they can just turn it on and remind themselves they're safe. And that retrains your brain and your body to, again, just like getting back to what we talked about in the very beginning of the conversation, right? It's like reminding yourself of the truth of your current situation, which might not be related to the past threats you experienced. It might just be you're safe right now, and that's okay. And then your recovery and healing nervous system turns on and takes over, and it knows what to do. Our bodies know how to heal themselves, right? That's an Eastern, Western, and tribal philosophy combined. Hippocrates of Western medicine said this. Maimonides said it. And all the Eastern and tribal techniques say it. Your body knows how to heal itself. If we don't allow it to heal itself because we're afraid of whatever, or in a fear state or traumatized, the healing process will not occur. So safety is fundamental. And Apollo is the wearable tool we developed for all those who can't access psychedelic medicines to be able to feel safe in their own bodies and remember how to jumpstart that healing process on their own.
You know, this is so remarkable. And for all of you who are watching and listening right now, I hope you just heard what Dr. Dave had just said about healing ourselves, right? And feeling safe and the difference that makes. And also, I've been wearing the Apollo Neuro for probably 6 months, perhaps a little bit longer. And it makes a significant difference. And I would encourage everyone not only to go out and buy one of these wearable technologies, but also in the interim, Dave, you have an app that anyone can download, and you can actually feel what the Apollo Neuro feels like when you're wearing it. So can you just quickly describe that to us and how they can find out about that app and test that out?
Yeah, so anybody who's listening to this, you can just go to the Apple App Store. This demo is only available for Apple right now, unfortunately, because they're the only ones who have unlocked it for us. But you can go to the Apple App Store on your mobile Apple device, download the Apollo Neuro app, 2 words, purple one with an A, and then open it and wait until you see the Feel Apollo screen on the screen in about 10 seconds. You click that button, and you can just hold your phone to your chest or hold it in your hands. Chest is the best way to experience it the first time, like I'm wearing mine. Just hold your phone to your chest, and almost immediately you'll feel this gentle, slow wave going up and down. And it goes up and down somewhere between 5 and 7 times per minute, which happens to also be the ideal breath rate that we enter when we start to activate our recovery nervous system, our vagal nervous system, and when we start to meditate. So if you were to breathe at 5 to 7 breaths per minute, because you have an Android and not an iPhone right now, you would have the same experience as you'd get if you held your iPhone to your chest and let it do it for you. The point is, technology can help us in a lot more ways than we were taught it can. And so now, you can have this experience of feeling this gentle wave on your body anytime you want through your iPhone, and take that feeling of calm with you, right? Like, our phones are mostly a source of stress. I think most people can identify with that. I mean, They're always pinging us. They're always notifying us to pay attention to them. And that is not signaling safety. It signals the opposite. Notification-based vibration, dings, rings, all this stuff, pings, it's all signaling the threat response to get your attention on it. That is not therapeutic. It's not healing. It's not helping with recovery. So what we did is we just said, okay, well, technology's come far enough to do this. Let's just do it. Let's just give it away for free to people. And so now anybody can experience this. But if you have the wearable, you get like a dozen vibes or more, and it'll turn on automatically and keep you asleep at night and keep you energized and focused during the day. But it's the same gentle vibration waveform up and down. And most people who feel it for the first time will say it feels like a hug, or it feels like somebody I like holding my hand, or it feels like snuggling a pet, or it feels like ocean waves gently crashing over me, as I'm lying on the beach. Like, those are the kinds of associations that people have, which is what we were aiming for. And it's so cool to me that, like, we've come to a place where that we're alive in this generation, and we have access to technology that is this powerful, right? Like, that's why I always tell people, as hard as it might seem things are right now, we have never been at a more exciting time in the history of the field of mental health and psychiatry. It's never been more exciting. And what we're going to see unfold over the next year, 5 years, 10 years is going to transform the entire paradigm of the way we think about mental illness. And, I'm confident that if we all get on the same page and align on what needs to be done as a medical field, we can cut mental illness in half in the next 5-10 years rates. I think that is actually achievable with technology. Psychedelics are going to help. It's going to take longer because of the regulations, but technology is available right now. So it could not be a more exciting time.
I love that. Well, from your lips, right? That is what we need to work towards. So I love that. And I love that optimism. And you would know you're in this field every single day and you see what's going on. You see the advancements being made. So I appreciate your perspective. So as we are winding down our conversation, I really could talk to you for hours, but I appreciate the time you've given us. So I would love it if you would give all of us, including me, a challenge. What is one thing, Dave, that you would challenge us to do starting today?
Can I give you two?
Sure.
All right, so the first one's really easy. It's just get more hugs. Get more hugs and give more hugs. That's the number one thing. If everybody just gave more hugs and got more hugs, we'd all feel so much better every day. It would be life-changing. The second thing is more of a self-practice, and this is really important, and it's called self-gratitude. This is an indigenous technique that I learned. I mean, we learned about it in Western culture and Eastern cultures, but I learned it from the Shipibo tribal culture in Peru, which is one of the oldest tribal medicine cultures in Peru, in South America. And self-gratitude is really the idea of every moment of your life, whether you're awake, whether you're asleep, as often as you can remember, try to find things in yourself that you can be grateful for. That's it. And most of us, myself included, were never taught to do this. And so what do? We look for things to be afraid of or things to be worried about, right? That's not gratitude. That actually makes us feel like total shit all the time. So anyone listening to this for free can literally transform their entire lives by just understanding that the neuroscience backs this ancient tribal technique of practicing gratitude. And it starts with the self. It starts with just, I woke up today. I got here today. I got to this moment. Despite everything, all the other challenges I had, I got here. It starts with taking a breath, right? And just being grateful for the ability in any moment to just say, I'm going to take a breath right now because I chose to, and nobody's going to stop me, right? And I can breathe slow, or I can breathe fast, or I can do whatever I want, but I can breathe by choice. And as soon as you start to do that and express gratitude for it, you're literally strengthening your gratitude muscle, which is like a muscle that you would strengthen. It's like a bicep, but it's not physical, and it's in your brain and in your heart probably. And you can strengthen this muscle anywhere you go without a gym. Like the world is your gym. That's what's so cool. You can literally do this anytime, anywhere. It just requires knowing that we can do it and that it matters. And if you start to know that you can do it, you have the ability at any moment to stop what you're doing and just try to find something to be grateful for, and that it actually matters. You're actually rewiring your neurocircuitry to think about the world from a perspective of gratitude and joy and love rather than fear and worry and concern. And you can do that in any moment. I mean, like, what can be more empowering than that, right?
Wow. I love that. That is so good. Thank you for that challenge. Two different challenges, but they are interconnected and something that we can all do. So, Dave, one final question to you, and it is this. What is one of the greatest gifts that life has given you that you didn't realize at the time?
Greatest gifts. I would say, other than life itself, I would say the greatest gift is probably like belief. Like I think we often, growing up in any Western religion, with the idea of God as being like outside of us, you kind of start to wonder about, like, is there actually a God? Is there actually a higher power? Is there actually something? It doesn't matter what you personally believe. If you're listening to this, that's not important. What matters is that belief itself is real. Belief itself is like real, like really important, right? Like when you believe something, you're taking your human energy and putting it into something that is greater than you. Or it could just be you, it could just be believing in yourself, right? But you're believing in something. You're directing human energy into something. And that makes it that much more likely to happen the way you want it to happen. If you believe in yourself, the chances of you being successful in anything you do goes through the roof. it's hard to quantify how much through the roof it goes, but it goes pretty far, right? If you don't believe in yourself, like we know this about the placebo effect, right? If you believe a treatment will work, it works 30 to 50% more of the time. If you don't believe a treatment will work for you, it works 30 to 50% less of the time. And believing that it won't work actually is more powerful than believing that it will in terms of influencing the outcome. So the mind is very powerful, right? Like our minds are so powerful. We can take 2 pills and give them to people, and one can be red and one can be blue, and they can both be made of exactly the same sugar from exactly the same factory, and the red pills always work better. Because people believe that a red signifies like healing, even though they're identical in every way, right? So, except the color. So like the mind is so powerful that if you start to recognize this ability that every single human on the face of the earth that was, just by nature being born human, that we have access to, that we all have this power of belief, which I didn't always know we had myself. It took me a few decades to figure that one out through just life lived experience. But as soon as you realize that that's real, all of a sudden you start to restore a sense of control and power to your life, because you can believe in things you want and believe in yourself and know that there is, effectively science that supports that you will do better as a result. It doesn't have to be God. Start with yourself. But belief itself is critically important. And I think that was one of the biggest gifts that I received in my life.
Beautifully said. That is so good. So Dave, I want to thank you so very much. This has been a brilliant conversation. I truly appreciate you sharing, being your true authentic self, allowing the conversation to go in a multitude of different areas. But I can just share with you, and I know this because we're going to get lots of feedback on this episode, your ability to share your insights and take, which you said at the beginning of the episode, be able to take complex ideas and share them in a way that are understandable, that are relatable, and in many cases for all of us, actionable. And I just want you to know how grateful I am for you. Thank you so much.
It's my pleasure. Thank you so much for having me.
It is my pleasure. And for all of you, thank you so very much for watching and for listening. And I do have a quick favor. Would you please take a moment to subscribe, rate, and leave us a review on Apple Podcasts? Let us know what you thought about this particular episode with Dr. Dave. And to enjoy more episodes, all you need to do is visit jscherbusinessconsulting.com, click that podcast button. And until next time, my friends, keep learning, keep growing. Make sure that you go out in order. It's on this wrist. Make sure you go out in order, and Apollo Neuro will provide the link in the show notes, and we'll see you on the next Business Minds Coffee Chat. Take care, everybody.